Roselle, good news for women. Do you often encounter embarrassing situations like having the urge to urinate right after using the restroom? The pain and burning sensation during urination can be unbearable. Some even experience blood in their urine. And sometimes, a simple sneeze can lead to urinary leakage. Suffering from urinary tract infections can be distressing, leaving you at a loss for words and greatly affecting your quality of life. In fact, urinary system diseases are quite common and pose a threat to our health, ranging from small kidney stones to tumors. Statistics show that women have a 50% to 60% chance of developing urinary tract infections and bladder infections in their lifetime. Women are 8 times more likely to be infected than men, and these infections are prone to recurrence. Therefore, today we will focus on discussing issues related to urinary system diseases in women. Why are urinary tract infections more prevalent in women compared to men of the same age? This is mainly due to the physiological structure and behavioral activities of women. The female urethra is shorter and wider than the male urethra, measuring only 2 to 4 centimeters, compared to 15 to 25 centimeters in men. Additionally, the female urethra is in close proximity to the vagina, making it easier for bacteria to enter the bladder through the urethra and cause infections. This condition is particularly common in sexually active women and those who have reached menopause. Urinary tract infections can occur in girls, adult women, and elderly women. Young women who have recently become sexually active are also prone to urinary tract infections. However, elderly women are the most susceptible to urinary tract infections. This is because after experiencing pregnancy and childbirth, the enlarged uterus extends to the bottom of the pelvis, causing damage to the pelvic floor and nerves. Traumatic childbirth, in particular, can lead to further damage to the pelvic floor muscles and nerves. During menopause, the lack of estrogen in women causes the pelvic floor muscles and urethral sphincter to gradually weaken. This weakens the support for the urethra and bladder, making it easier to experience urinary leakage when coughing or sneezing due to increased abdominal pressure. Therefore, the chance of urinary incontinence in older women is as high as 50% to 60%. Urinary incontinence and bladder dysfunction can cause significant distress in work, family life, and social situations. However, many female patients avoid discussing this topic due to embarrassment. Some women who have jobs that require them to hold their urine frequently are also at risk. During the pandemic, many nurses and frontline workers refrained from drinking water and using the restroom while wearing protective clothing. However, after 6 to 8 hours, this can potentially lead to urinary tract infections and, over time, bladder dysfunction. Therefore, it is important to drink plenty of water, avoid holding urine for too long, and even for work-related reasons, not exceed 4 hours before urinating. It is recommended to have a habit of going to the restroom at least 6 times a day, as this helps eliminate viruses from the body. Some young women have a habit of exerting force when urinating, which is not good and can result in weakened bladder contractions or worsened bladder prolapse. Here are a few summarized tips to help our female counterparts troubled by these conditions. 1. Drink plenty of water. 2. Consume Roselle flower and cranberry. 3. Avoid foods high in oxalic acid to prevent stone formation. 4. Urinate frequently and avoid holding urine. 5. Wear cotton underwear. Avoid wearing jeans or tight pants to promote breathability. 6. Pay attention to hygiene in the external genital area. It is best to urinate immediately after sexual intercourse. Let's change our unhealthy habits in daily life and take good care of our urinary system. Don't wait until inflammation occurs to pay attention to it. So, how can we prevent and improve urinary system diseases in the long term? Roselle, nurturing women's intimate health. Roselle is a natural health supplement that extracts the essence of Roselle flower, cat's whiskers, Java tea, and Strobilanthes crispus, 3 traditional herbal plants, using scientific methods. It preserves and concentrates the natural active ingredients of these plants, making them easily absorbed by the body and meeting the daily intake requirements. Roselle has heat clearing, detoxifying, diuretic, kidney protecting, and liver protecting properties. It helps eliminate toxins through urine. The product has no side effects and is cost-effective. It works well in inhibiting uric acid production, treating urinary tract infections, and addressing urinary tract stones and gout. Long-term consumption of Rocelle can delay the aging of bodily functions, enhance immune function, prevent cardiovascular diseases, lower blood pressure, improve digestion, and improve liver and gallbladder function. If you feel restless, have a poor appetite, bad breath, body odor, restlessness, excessive liver heat, or frequent acne breakouts, Rocelle can help improve these conditions. A clinical trial conducted in France on 60 to 90 women who experienced discomfort or infection in the urinary tract at least 8 times within a year found that daily intake of Roselle flower extract resulted in a 77% improvement after 6 months. Therefore, Roselle flower is considered one of the rare products that have been proven effective in preventing women's intimate infections. In conclusion, the urinary system is like the waste processor of our body. To keep it functioning normally, besides maintaining a positive attitude, adjusting our diet and lifestyle, and paying attention to the signals our body gives us, we should also be proactive in prevention, early maintenance, and treatment to enhance the immune function of the urinary system. Roselle is a natural health supplement suitable for long-term use. It is available in pharmacies and Chinese TCM medicine stores in Singapore. The retail price is Singapore $48 only. For inquiries, please call 6562-5526, 6562-5526.